Okay, so Dr. Ipak, thank you so much for meeting us here. It's been a wonderful time knowing you over this last year, and I'm happy that we have a chance to talk. This is going to, well, thank you very much. This is going to be a most heartfelt moment for me because we've just completed the operation on my wife, and we've just been discussing before we turned the cameras on about how I started here last year, and I came for some implant surgery for dental. And ironically, it didn't turn out the way I thought it was going to turn out because of my bone loss. And we discussed with you about the possibilities of doing bone transplant and this sort of thing, and this still may be in the future, but I was able to at least get my situation with my dental corrected and see my smile. Turned out just fine, and I'm happy with that. And yet at the same time, I know there are many people that are going to be in a similar situation. But my wife came back with me this time because when I met you last year, I was so impressed with your heart. I think more than anything else, it was the concern and the feeling that you were able to portray without any words that convinced me and my wife that she should come back and let you do the surgery on her where she wouldn't have let anyone else on the planet do it. And I found that to be very special indeed, so I want to thank you for that before we even start.
Thank you for the kind words of yours.
Well, they're well deserved, I must tell you, and the outcome is even better than we expected. She's looking so much younger that's causing me to think that I'm going to have your services as well at some point. When I get older, I don't know, maybe I'm not so old yet, but when you have a wife that looks so young, it makes you start to think a little bit.
It made you look younger.
Yes, I did. Suddenly I'm
I can't see your crow's feet now.
You can't see my crow's feet.
Only your wrinkles are...
Well, we can discuss that a little bit, and when you're ready to discuss that, we can get into that. What I would like to do is to talk about what are the problems that someone should anticipate when they're considering plastic surgery and they're wanting to get this done, and maybe they're going to leave the United States or Western countries, or any country for that matter, and come here to get this service done. What should they think about? What should be the first things that they should think about before they try to make that arrangement?
Actually, Bill, what you're talking about is aesthetic surgery or cosmetic surgery.
Aesthetic surgery.
Right.
Right.
Because plastic surgery means a lot of things to different people.
Okay.
If you talk about plastic surgery, me as a trained plastic surgeon focus more on reconstructive work.
And I know that you've done a major amount of reconstructive work, and we'll touch on that more in a moment, but the cosmetic surgery then.
Yes. What I believe is cosmetic surgery should be done by a qualified plastic surgeon who has got enough experience in reconstructive work and he's trained in the fineness of cosmetic surgery.
So let me understand that a little clearer perhaps for the audience. Without the background in reconstructive surgery, you don't have that foundation to do cosmetic surgery to get the best results.
Absolutely.
I'm interested in how people would approach the subject and what in preparation they might do. And I know you talked about the telemedicine things. If someone were considering plastic surgery, what should they anticipate as a need medically before they could get that plastic surgery? What kind of tests do they have to go through before?
Absolutely. We'll run a battery of tests and get them their cardiovascular and respiratory status ascertained. If they are smokers, they should stop smoking totally before the surgery.
Right.
If they're using any drugs or any kind of abuse, that should be stopped before you consider the surgery. If possible, stop alcohol. If not, at least reduce the amount you're taking. Right. Reduce the amount you're taking. So
we're really, if you're a person who does consume alcohol, they should at least reduce it to a couple of drinks a day or something like that.
Yes.
That seems to be an acceptable amount. People, they go to dinner, they eat, have a glass of wine, this sort of thing. But if they are doing that, then they want to minimize that.
You should not go on binge drinking.
No binge drinking. Right.
Which will mar the results. And maybe your beauty will be enhanced
as a result.
Good habits, which is forced.
So let's talk about the kinds of cosmetic procedures that take place. And from the brochure here, I can see there are several different things. And I see some things like hair transplant, for example, and also bariatric surgery for obesity. Now, if they were going to have this bariatric surgery done, cost-wise and that sort of way, what would it compare to the prices of the same thing in the U.S.?
The cost-wise, for example, hair transplantation
yes.
should cost at least 3 times less here.
3
With
times
the
less.
same level of expertise and care.
With the same level of expertise and care,
Definitely.
they're going to be about 3 times less. That's a substantial amount.
Definitely.
As you may know, cosmetic surgery isn't covered by insurance.
Exactly.
And so this sort of thing is going to be a big question in people's mind. Hair transplant is certainly a large thing. As people age, they start to lose their hair and they'd like to maintain that youth. Also, if we get overweight, sometimes they would like to do the liposuction. So you do liposuction.
Yes.
And what other types of procedures?
Like abdominoplasty, which you call commonly a tummy tuck.
Tummy tuck.
So, whole body contouring. It's not just the abdomen we are concentrating. Suppose you have fat distributed in undue proportions in the body.
Right.
We contour the whole body and make you look much better.
And how much time should they allow when they're coming for such a surgery?
At least, if you go for a whole body contouring, you should have at least 10 to 15 days with you.
10 to 15
It's
days.
not you go do it in one day and go home the next day. I would love the patients at least to remain there for 10 days. Whereas if you are coming for a smaller procedure like blepharoplasty or a rhinoplasty, maybe 3 or 4 days is good enough.
So someone on a 2-week vacation could actually come here.
Definitely.
And they would allow enough time for a follow-up before they go back to the U.S.
Definitely.
So the more complicated the procedure, the longer. And
not necessarily.
Not
Depends
necessarily.
on the post-operative, how the body responds. If there is no hematoma, if there is no infection, you go on the full.
I see. So that actually...
Some cosmetic surgeries are daycare surgeries, like rhinoplasty or putting an implant, breast implant for example. You can send the patient immediately after the surgery.
So, recuperating time. I know that when I had some of my procedures, I need to go lay up for a couple of days to recuperate. But I didn't need to be in the hospital, so it's possible to stay in the local area in a nice home, hotel, and then come back in for the outpatient service.
Yeah, you have very nice hotel quite close by with natural resort kind of.
Yeah, Nariani Farms, that's a great place. Much less expensive, that's true, much less expensive. So if someone were wanting a consultation before they come, you would be able to take and do this consultation through the telemedicine department?
Through my website, and we have something called Apollo eDoc, where you can schedule your appointments, and of course my mobile number
is available, of course. So mobile eDoc, that would mean then that you could schedule an appointment through the email, internet, and you can
my whole schedule opens. My background is there. You go to Apollo, www.apollo.edoc, and then type Dr. Ayyappan, plastic surgeon. Then the whole thing opens, and you ask for schedule an appointment. The appointment is scheduled.
So they could consult with you ahead of time. Are there any costs involved in these things? These pre-consultations?
It's free.
Because this is in preparation for possible services.
Yeah.
Okay. This is good to know.
You get the genuine advice of what exactly can be done. Of course, the final thing will be decided once you clinically examine the patient in person.
So in the U.S., there's a lot of advertising about string lift. And I know that... Thread lift, commonly called string. I know that you had made a comment that such a thread lift has problems that are not being discussed necessarily by the doctor who performs the thread lift, because they want the convenience factor to have you look so pretty so quickly with minimal intrusion, I guess, on the face. But tell me your opinion about that. What are the problems that come up from that? What do you think about that?
Well, in my opinion, I'm not happy with threads.
You're not happy with threads?
Yes. It is supposed to work good in the hands of few specialists. But in my experience, my patients with thicker skin do not do well with threads. I think conventional surgeries give a guaranteed long-lasting result.
So, I don't know exactly the cost of this thread lift, but
they're quite expensive.
They're quite expensive. And my anticipation is for about the same price as a thread lift, you could come to India, have a full face lift, full face regeneration, and go back and have a vacation at the same time for even less than these thread lifts.
But the surgery is invasive.
The surgery is invasive.
The face gets edematous.
In other words, you're going to swell up. You're going to swell up and there's going to be bruises.
There are bruises. And there are chances of infection.
And there are chances there.
There are chances of flap necrosis, despite all the precautions we take. And we are equipped to handle it. The patient should be totally aware of the pros and cons, like I say. If you take surgery, yes, you take it with all this risk, which we will try our level best to minimize and prevent. And we are liable to treat it when the complications occur.
So it sounds as if that should be a viable option for someone to look at least before they start spending.
They should understand what they are going to get.
And you think I'm wrong when I would suggest that the thread lifts would cost $3,000 to $5,000? Is that a reasonable amount?
I think so.
And so in my mind, you're not very far off from a full facelift from this.
Yes.
What we can do is say thank you very much, Dr. Ivan, for everything that you've done. And what we will do is pick up on this interview at another time and we can add to it.
Thank you.
Thank you.
It's been a pleasure.